Superiorly we call the ilium, inferiorly and anteriorly we call the pubis, inferiorly and posteriorly we call the ischium. So the ilium, pubis and ischium are going to form the hip bone. This hip bone belongs to the left side. It is better you keep and hold in your hands such as a gun. If you put your finger here inside of the obturator foramen, it is such as the gun. This hip belongs to the left side. How we can find it belongs to the left side? Look at here. The acetabular look and directed laterally. The obturator foramen compared to the acetabular is inferiorly. These greater sciatic notch and lesser sciatic notch are posteriorly. And here is the medial surface. So this hip bone belongs to the left side. About the right side, again it is left side. About the right side, look at here, this hip bone belongs to the right side. Again, the obturator foramen inferior to acetabulum, this greater sciatic notch posteriorly, and acetabulum laterally, okay? And obturator compared to the acetabulum inferiorly. These two bones never belong to one person because it is real bone and it is the mullage. But anteriorly they are going to connect and making joint to each other that we call the symphysis pubis. It is a kind of cartilaginous joint. It is the medial surface making the symphysis pubis. Posteriorly, both hip bones far from each other, yes? And here we have the sacrum. Now about the hip bone, about the ilium, remember, superiorly the largest part is ilium, superior border completely formed by the ilium, anterior border formed by the ilium and the pubis, inferior border formed by the pubis and ischium, posterior border formed by the ilium and the ischium. Okay? Now about the ilium, iliac crest is going to form for you the superior border. And about the medial border, this border is going to form for us the medial border. Which segment of the hip bone are going to form the medial border? Ilium and pubis. This part of the medial border we call arcuate line. Here is the arcuate line. In your exam, it is possible that I ask you, this hip bone belongs to the left side or right side? You know it belongs to the left side. Show me the arcuate line. Here, it is possible I ask you what's the name of this part. You should tell to me it is arcuate line. Show me the anterior superior iliac spine. Show me the anterior inferior iliac spine. Show me the iliopubic eminence. Iliopubic eminence is here. Show me the iliac fossa. Show me the auricular surface. Show me the iliac tuberosity. All these structures belong to the ilium. The auricular surface also belongs to the ilium. Arcuate line belongs to the ilium. Iliac crest belongs to the ilium. Iliac fossa, gluteal surface belongs to the ilium. In lateral surface, I am able to show you three lines. The posterior gluteal line, the anterior gluteal line, and inferior gluteal line. Four small portion. And this four small portion is the area for attachment of some of the muscle. You read about this muscle in lower limb. Here you never need to read again. Only you know that it is a gluteal surface and we have three oblique lines. Now here is the acetabulum. Superiorly is going to be formed by the ilium. In the central part, you have the acetabular fossa. This is non-articular surface. The ligament of head of the femur is going to attach here. In the peripheral part, U-shape or the C4, it is articular surface and we call the lunate surface. We call lunate surface. This is acetabular notch. Always when we are going to distinguish this bone belong to the left side or right side, you should know that the acetabulum Compared to acetabular notch, this position is superior. Means this notch is inferior. And normally this notch is going to complete by a transverse ligament, transverse acetabular ligament. Now, inferior to the acetabulum, you are going to look at the obturator foramen. For obturator foramen, only pubis and ischium participate. But in acetabulum, ilium, pubis, and ischium, all these three segments participate. Do you get that?
Yes.
Now, about the pubis. It is the pubis, body, inferior ramus, superior ramus. Body of the pubis, three surface, anteriorly, posteriorly, and medially. Medial surface is going to make joint with the other pubis in the other side. Anteriorly is a site for attachment of some of the muscle. Posteriorly here, it is going to be posteriorly. It is also called the pelvic surface. Pelvic surface, medial surface, anterior surface. What about the superior rami? Please look at the superior rami. Three border. Here, superior border or pectineal line. Anterior border or obturator crest. Inferior border. So superior rami. Superior border or pectineal line, anterior border or obturator crest, and inferior border. Between these three borders, superior border or pectineal line, obturator crest or anterior border and inferior border, between these three line, three surface, this triangle surface we call pectineal surface. It is the obturator surface, and here is the pelvic surface. This pelvic surface in the female sex is near adjacent to the round ligament, and in the male sex it adjacent to the spermatic cord. So it is the superior rami, three borders, superior, anterior, and inferior, three surface, pectineal surface triangle. Pelvic surface that in the female sex the round ligament is passing here, in the male sex the spermatic cord, and here is a groove for passing of the obturator vessel and the nerve. About the inferior rami. Inferior rami consists of two borders, medial border, lateral border. Medial border, lateral border. This medial border from this bone and the medial border from this bone making the infrapubic angle or subpubic angle here. Subpubic angle in the female sex is around 80 to 85 degrees. In the male sex is around 50 to 60 degrees. Okay? Now about the surface, you can imagine anterior surface, posterior surface, or we can imagine antero, superior surface, postero, inferior, mix. But it is easy, you said anterior and posterior. About the ischium, the body is vertical position and the ramus is in horizontal position. Ramus of the ischium and inferior ramus of the pubis fuse to each other and make the ischiopubic ramus. Inferior ramus of the pubis, ramus of the ischio join to each other, fuse to each other and make the ischiopubic ramus. About the body, consists of three borders. Look at here. This is the obturator border or anterior border, lateral border, and posterior border. So the body, posterior border, lateral border, and obturator or anterior border. Between these three borders, three surfaces, femoral surface, and here you are going to find the ischial tuberosity that the hamstring muscle are going to attach to ischial tuberosity, and here is going to form for us the pelvic surface. It is going to form for us the lateral wall of the ischioanal fossa. Later, I'm going to speak about the ischio-anal later, tomorrow, in the class, theory class. Now, the ischium also has a spine that we call the ischial spine. Immediately, inferior to ischial spine, we are able to show you lesser sciatic notch. Here is the posterior superior iliac spine, posterior inferior iliac spine. Greater sciatic notch. And if I rotate, here is the iliac fossa, auricular surface, iliac tuberosity. And here nothing remains. In the class, yes, 2 hours I speak about this one, but in the practical it is very easy. Okay? Do you get that? Do you have any questions?